Hello, welcome to QAxon. In this video, I am going to talk about parathyroid gland and the hormones secreted by it. The main role of parathyroid gland is calcium homeostasis. So, I will be explaining about calcium homeostasis as well. The blood calcium level has to be maintained precisely because calcium is very essential for contraction of skeletal muscle, smooth muscle and cardiac muscle. It is also very essential for clotting mechanisms and neuronal transmission. Now let's see about the distribution of calcium. About 50% of calcium is distributed as ionized calcium and 9% is calcium complex to anions, and this is diffusible. The remaining 41% is protein bound and it is non-diffusible. An interesting fact about our body calcium level is that only about 0.1% remains in the extracellular fluid, about 1% remains in the cells and the organelles, whereas all the rest is stored in the bones. Hence, bones act as reservoirs of calcium. Bone is composed of organic matrix which is strengthened by calcium salts. The organic matrix consists of 90 to 95% of collagen. Remaining ground substance is composed of ECF, proteoglycans, chondroitin sulfate and hyaluronic acid. The bone salts are composed of mainly calcium and phosphate, and the major crystalline salt is hydroxyapatite. Magnesium, sodium, potassium and carbonate ions are also present. Let's move on to see the mechanism of bone calcification. There will be secretion of collagen molecules and ground substances by cells called osteoblasts. Osteoblasts are bone forming cells. The collagen monomers then polymerize and form what is called as osteoid. The osteoblasts become entrapped in the osteoid, and at this stage they are called osteocytes. After that, the calcium salts begin to precipitate on the surface of collagen fiber and form hydroxyapatite crystals. Bone contains a type of exchangeable calcium that is in equilibrium with the calcium ions in the extracellular fluid. Normally, it amounts to about 0.4 to 1% of the total calcium in the bones, whereas a small amount is also found in other cells which have a high permeability, like those of the liver and the gastrointestinal tract. These exchangeable calcium, they actually provide a rapid buffering mechanism which help to maintain the level of calcium ion in the extracellular fluid. We now know that bone is made up of matrix and salts and that we have exchangeable calcium in it. Now I am going to explain about the steps involved in bone remodeling. Bone is continuously deposited by osteoblasts and it is continuously absorbed by osteoclasts. Osteoclasts are large phagocytic multinucleated cells. Now let's see the mechanism that is involved. The osteoclasts, they actually send out villus-like projections which form a ruffled border near to the bone. These villi, they secrete proteolytic enzymes and several acids including citric acid and lactic acid. These enzymes digest or dissolve the organic matrix of the bone. The osteoclasts usually exist in concentrated mass. They can create a tunnel of diameter that ranges from 0.2 to 1 mm, which is several millimeters long. At the end of this time, the osteoclasts disappear and the tunnel is invaded by osteoblasts, and then new bone begins to develop. Bone deposition then continues for several months and the new bone will be laid down in concentric circles called lamella. When this bone encroaches the blood vessels, the bone deposition stops. The canal through which these vessels run is called Haversian canal. This is an overview of calcium metabolism. You can see here that most of the ingested calcium is excreted in the feces. You can also note that the kidney also plays a role in excretion of calcium by reducing the reabsorption of calcium in the nephrons. Now that we have seen about calcium homeostasis and physiology of bone, let's move on to the hormones regulating blood calcium level. We have parathyroid hormone, that is parathormone, calcitonin, and vitamin D. These three hormones play an important role in maintaining the calcium homeostasis. Parathyroid hormone is secreted by the chief cells of the parathyroid gland. It is an amine hormone. It is secreted as pre-pro-parathormone and converted to pro-parathormone in the endoplasmic reticulum and stored in Golgi apparatus as parathormone. It plays a main role in controlling the extracellular calcium and phosphate by regulating intestinal reabsorption, renal excretion, and exchange between the extracellular fluid and the bone.